Yes, so it is possible that we can do some prediction even when there is limited stuff if the individual is making the preference-sensitive decisions. So that's one possible measure. There are others. John, you want to go from here?
What if the research question is about an ethical issue? We sometimes delve into the normative. So our regulatory work is asking whether this object is allowable in society. In that, there is no revealed preference, or maybe long-term there is a tolerance to let it on society and then come off, but that's not a full experiment out in society. There are other aspects that sometimes I've brought in. So my recent study on vaccines was people couldn't answer. There was a particular part of Nigeria where people didn't take vaccines and they didn't know why, and they brought me in to try and understand some new areas of research using stated preference work to potentially identify what might be going on. That can't be validated because we're looking for a needle in a haystack.
Yeah.
And quite often, a lot of my work in Africa is quite often trying to overcome biases or potentially change policy. It's more advocacy related, and there isn't necessarily a right and wrong decision. It is, we're trying to inform that societal normative judgment.
Yeah. Another thing, though, that even when we're talking about products, one thing that comes to mind is, first, a single study is a single study. And so you have to be careful on the conclusions you draw from a single study. But when for some reason, there was a whole bunch of preference work done in renal cell carcinoma with target VEGF inhibitors and targeted agents. All different, but they all basically came to the same types of conclusions. You know, they're looking at similar toxicities. The rank ordering was pretty much the same. They were measured a little differently, so direct comparisons are tough. But they were when you look at the totality of these 5 studies, all done by different groups, they start to give you the same message. So that's one way to get sort of external validity in a case where you're not going to have individuals necessarily choosing. There are other tests that people are trying to bring in to look at the validity. Is there internal consistency? Are there other properties that we see that would give us, and my worry with validity is that people will overinterpret or try to come to a single number. But can we look at our data critically and see whether it follows patterns and norms that we would expect? You know, and then, but external validity is the holy grail to some people, and I just think it's the wrong question. Okay, so.
I'm gonna
get going. All right, he's timekeeper. Yeah, and we'll have I hope we will have plenty of time for questions. So I rearranged a little bit this portion I took out some of the boring theory stuff. Happy to share it with you if you're interested, and decided to take a step back and look at preferences and stated preference methods a little more broadly. And then I had a series of slides that I had put together before that at least bring in the concept of the threshold technique and direct elicitation. And I try to contrast some of the properties of threshold technique, direct elicitation, and discrete choice experiments. The other question or request that we had was to look a little bit more at best-worst scaling. For simplicity's sake, and I know this is being recorded, so on the recording, please understand that I'm only doing this for simplicity's sake. Best-worst scaling case 3 is almost exactly like a discrete choice experiment. They're not the same thing, but they have so many similarities. For today's purposes, we're going to assume they're the same. Best-worst scaling case 1, I'll show an example in one of the case studies, and I've asked John to pull together from one of his studies a couple slides on best-worst scaling case 2 so that we can correct the narrow focus that we wound up in and broaden that out a little bit. So I hope that by making a few tweaks here this afternoon, we'll be able to do it. I said I wanted to step back. When we talk about preferences, the way that I view it, there are 3 types of preference information. And not everybody agrees with me on this, so I'll be perfectly frank about that. There are some people who say that preference information is only information about trade-offs and quantifying those trade-offs. I disagree. Preference information tells you there are 3 types of preference information. The first is what matters. You can get this quantitatively, you can get this qualitatively, but the first question is always what matters, and we do not always know the answer to that question. The second question is how much does it matter? Again, we're not talking about trade-offs here necessarily. We're talking about quantifying sort of the magnitude of importance, or how much does something matter. Then we get to trade-offs. Implicitly, we are, when we're doing trade-offs and doing conjoint analysis or discrete choice experiments, we're making this judgment going into the development of our survey. Sometimes we do it formally, sometimes we do it informally, sometimes we just make it up. But we are implicitly determining what we think is important in terms of what we put into any kind of trade-off exercise. This, we may not need to get to trade-offs. It depends on our research question. If we just want to know priorities, trade-offs may not be what we need. And then often when we do trade-offs, we can recover some sense of relative importance, or at least relative importance to the decision. And here, generally speaking, this is fairly straightforward. The methods are easier. A lot of this can just be quantitative individual interview or qualitative individual interviews. This, you've got to put more structure around it. This is where things get complicated. So to put what we've been talking about so far today, we've been focusing down here. But that is, and some people will say only this is preferences. And I disagree. It starts up here. And maybe this is all you get, but this is important information about what matters to people and what they prefer. And then this, and then this. All right? So there are multiple methods, as I mentioned before, not all of which are stated preference methods and not all of which we're going to talk about today. There's this whole group of methods that are used, some of which are trade-off methods, some are not. But they're used mostly in decision analysis, multi-criteria decision analysis in particular. And so there are lots of ways that people get weights, which are preference-based for criteria in decision-making. I think it's a requirement to be a member of this society that you know what these things are, a time trade-off and a standard gamble. They are stated preference methods. To get the weights, those are stated preference methods. The EQ5D itself is not a preference method. It's only a preference method once you get the tariffs, and you get the tariffs by doing a stated preference exercise. So these health state utilities are really, in fact, stated preference methods when you're getting those tariffs using time trade-off or standard gamble. They are choice-based. We're asking people which would you choose in each one of those scenarios. They're repeated scenarios to get you to some point of indifference. And then there are the other stated preference methods, most of which we're talking about here. We'll talk a little bit about all of these before the end of the day. And there are actually revealed preference methods out there. The best, most robust, coolest, most convincing type of revealed preference method is as a crossover trial, where at the end of the trial you get to say, okay, you've had both, you have to continue, which one do you want? That's a revealed preference. You expose people to both, they experience both, you let them choose how they continue. The most recent one of these is Genentech did a really interesting study, or sponsored a really interesting study on subcutaneous versus IV rituximab. Did a really interesting design on a crossover study. They were basically trying to get the new formulation approved by FDA. They put that in. It actually wound up in the label. It's one of the first times patient preference information. It's under patient experience information. No one knows quite where to put it in the label at this point, but it actually made it into the label. But that came from a trial. All right, so we're not going to talk any more about those. I just think that's a really cool example. We're going to focus the rest here. But there are, as I alluded to in the very beginning of our day today, there are other methods. And I don't think, just because my expertise happens to be here, that when we're talking to people about preference methods, we ignore everything else. All right? So direct elicitation I mentioned. Does this look familiar? Right? Direct elicitation simply is if A is drug A and is an actual drug, and drug B is an actual drug, I can ask you, would you prefer drug A or drug B? Same framework. If I want, I can break it down like this. Still a choice at the bottom, but the difference is each profile represents a real drug. John mentioned this too when he was talking about his survey. Typically, if we're going to do something like this, we do it at the end because we don't want to bias people, but sometimes this is the only question you get. The nice thing about this is for every individual, I get, did they choose A, did they choose B? And I can say, the people who chose A tend to be older, tend to have more children at home, tend to have had their disease longer, whatever it may be. I get a single observation that I can then regress on all the characteristics of the respondents. So I can say a lot with a single question. This is non-experimental. The hard part is determining what goes in these cells. All right. Means, medians of clinical data, from which source, is this an indirect comparison? I mean, where do you get the data for this? That's the hard part. Once you get the data for that, that's easy. So that's direct elicitation. Then we have threshold technique. Ooh, look at the setup. Kind of look the same? What we do here is generally, this is one way to do it. I'll show you an alternative in a second. But imagine these are real world options. We tend to have a reference treatment and a target treatment. So the left-hand side is typically the reference treatment, which is often the status quo, the state of the world as it is today. The target treatment is what is new, or what is some change from where we are today. I was telling some of you earlier, some of the early work in this would be best supportive care, and this was aggressive chemotherapy. Then you take one of the attributes, and you either increase the level or decrease the level based on which one they chose. So, and usually it's only in the target condition. So if I choose the target condition, I take one of these and make it worse until I see the person switch to the reference condition. If in the first choice they choose the reference condition, I take that one over here and I make it better until they switch. It gives me an idea of how big does this spread need to be on this particular attribute for the person to be indifferent between the two. So an example, and I apologize that this may not be quite as clear. Oh, it's not too bad. In this case, this is an example from Kopek et al. There's a corresponding paper by Richardson et al. Back in 2007. And essentially what they did is they wanted to look at, for an analgesic that reduced pain from a level of 5 to a level of 3. That's an improvement, and an improvement of 2. What level of risk of all of these different types of side effects and out-of-pocket cost would people be willing to accept in order to get that benefit? The idea was not to build the perfect profile or necessarily to analyze a drug, but to say how important is this benefit when we compare it to these. They're individual trade-offs. It's not all done together. These were all individual. So for example, they would start here. Notice all the risks are the same in this particular case. Doesn't have to be, but they're all the same. They would start here with hypertension, and they'd say, which one would you choose? Everybody should choose B here. B is unambiguously better. Then you say, okay, what if I made this 15%? Would you still choose B? Oh, you wouldn't choose B anymore. Well, what about 12 until we come to the indifference point? Or if they said, I'll still choose B, then we say, what about 20, 30, whatever? The initial threshold techniques were called modified standard gamble. All right, so it may look familiar. It's not that, it is different in that it doesn't have some of the same structure of a standard gamble of being the gamble between death and perfect health. But it is a trade-off on risk, or the other thing that makes it different than a standard gamble, any numeric variable. Anything that I can change incrementally, I could use as a threshold. But look at this, I mean, the setup is not that different from what we're doing in conjoint analysis. And then back to the DCE. The other nice thing about the threshold, which is not dissimilar from the direct elicitation. for every individual, I either take them to a point of indifference or I take them to a point where I can impute the indifference between 2 points. So I get a single number for each threshold for each individual. I can take that number and regress it on everything I know about that person. So I could say, older people are less willing to tolerate hypertension in exchange for that benefit. People with more children are more willing, et cetera. So I'm able to actually look at that single number and see what might be driving my preference for that to be different than your preference. Okay. And then when I get to the DCE, what I get is a preference weight on every one of those attribute levels, and I'll show you that in a second, how we get there. But we'll get a preference weight on every one of those attribute levels. They're all estimated simultaneously. I have to get repeated questions with different comparisons to look at the pattern of choices. That's the key. I'm looking at the pattern of responses in a DCE. And then cumulatively looking at those data together and saying, what am I seeing in terms of the pattern? So I'm not getting to an individual choice on an individual question or an individual point of indifference. I'm doing a lot simultaneously, which is really powerful. But I can't use one variable about me to predict 16 variables that define my preferences in this framework. And we're going to delve a little bit more deeply into that. So the trade-off framework, this is a way of kind of thinking about how we get from nothing to something when we're doing these analyses before we even get to the actual statistical analysis. So imagine I have a drug that a response rate is a good thing, also has adverse events, and the possibilities are defined by these 9 cells. So I could have up to a 90% response rate down to a 25% response rate between 10 and 40 events per, 1,000 people. Really doesn't matter. So what I want to do is I want to fill in this grid somehow, and I want to get to a point where I can look at the rate at which I'm willing to trade one of these for the other. What is the trade-off between adverse events and response rate? So imagine I start with questions that look like this. The first one, I have the highest response rate and the lowest risk versus a medium response rate and the lowest risk. Unless they're making a mistake, which is possible, or unless I've really messed up, which is also possible, I would expect everybody to choose option A. Then I go to another question. I now have a low response rate with the lowest risk, the best response rate with the highest risk. Which do you choose? Well, they're about the same. Let's go back to my grid. This was the highest response rate with the lowest risk, was preferred to a lower response rate, or no, greater risk with the same response rate. I had this comparison. So I can say that A is preferred to B. Then I compared these two and found out that I was indifferent. Okay, so these two are the same. This one's better than that one. That one's the same as that one. So this one is preferred to both of those. I can continue to ask a series of questions where I'm asking people to choose, and I can begin to fill in this grid. A is preferred to B. B is preferred to C. C and C are the same. C is preferred to D. D and D are the same. D is preferred to E. E is preferred to F. Generally, we would expect to see that this would be the most preferred, because all the goods are in this direction. We would expect to see that that was the least preferred, so A and F, that's no big surprise. But what's in the middle, I don't know. That's why I need to ask the questions to elicit those trade-offs. Now, this is a simple 2x2, but this 2x2 allows us to plot these out. So I've got greater risk from bottom to top over there on the vertical axis, and I've got cholesterol reduction instead of response rate here as I go from left to right on the bottom. So my good stuff is down here again. My bad stuff is up there again. I plot these out Well, if my A is preferred to B, it's down here, and my B's are the same, in theory, there's a line going through here called an indifference curve that says that any combination that lies on this curve, I am indifferent between. So I could be here, and I would be just as well off as I was there, which is just as well off as I was there. I could, my C's go together on the same line. My D's go together on my same line. My E, you can imagine there's a line here. F, you can imagine there's a line here. The point is I'm mapping out a space where A is preferred to B or anything that's equivalent to B from a preference perspective. Anything by which I am indifferent between that and B. B is preferred to C, C is preferred to D. Why that matters is I now can start putting this in a real world context. Imagine I have that curve for something in the real world. And it gives me risk level 0, not 0 risk, but risk level 0. Health of 0, not 0 health, but health level 0. I have a starting point. I get an intervention that says I can improve your health at no cost. That puts me at a higher utility. I'm further down toward this corner, which is a higher utility the way I've laid this out. Skipping the theory, I don't show you how we laid all this out in the difference. So, but in this particular case, higher utility is down here in the bottom right-hand corner. So I put you on a different indifference curve. I've made you better off. The question for trade-offs becomes, how much risk can I then impose on you that leaves you no worse off than where you started? No better off, no worse off. How can I put you back on that original indifference curve? It's a different point on the indifference curve. But if you're indifferent between anything, any option or combination that's on that same indifference curve, it doesn't matter where you are on the indifference curve. So in this case, I give you this. How much of this can I impose? This is often referred to as maximum acceptable risk. What is the maximum level of incremental treatment-related risk that I would be willing to accept in order to get this improvement in health? That's the trade-off. So this is how we would map it out using indifference curves. It's really just, you know, for this, what's that size?
Yeah. It seems like there's some assumptions that are going into this that are
there are lots.
Okay. I'm having trouble articulating them. Can you maybe articulate what the key assumptions of this approach are in terms of how people may value the risks and
well, how they may value them is up to them. So I think it's maybe more of a practical matter. It's how I ask them. So I need to...
If you're asking them and assuming that things are linear between them,
I
might personally have a threshold.
Well, first of all, this is for any individual or for the sample, right, but it's not assuming any heterogeneity at this point. We'll show you how you get there. So yours and mine could be different. Whether it's linear or not, I don't know. This curve could be linear, so that as I have incremental, assume this is measured on a continuous scale or a numeric scale. As I have incremental increases in health, I have proportional increases in risk. That may or may not be true. That's an empirical question. There's some theory behind why this should look that way, but ultimately it's an empirical question. So yours could be different than mine. It may be linear, it may not. I'll show you some examples of how we would estimate that. And what we try to do is we try not to impose functional form on that when we estimate this. All right? We can do the same thing with cost. I'm starting out at cost 0, health 0, and then I say, I'm going to improve your health. Now I'm going to start taking money away from you. How much money can I take away from you to leave you no worse off, no better off in the end? At what point do you say, well, I'm worse off than I was when I started? Same thing. That's marginal willingness to pay. How much more am I willing to pay, or what's the increment that I'm willing to pay in order to get that marginal improvement? We can do this with time. Time's a little tricky for a number of reasons, not the least of which is we had bad things going up on the left, time's a good thing. So this has to be a reduction in time. How many years can I take away from you? That's why that big arrow is there on the left, because time is a good. It's a positive thing, presumably independent of other stuff. But still, I could look at some sort of time equivalent by saying, if I can increase your health, how much time can I take away from you? This is basic time trade-off. If those were my only two attributes, it's a time trade-off. That's essentially what we're doing. This is just another way to lay it out. Right. All right. Analysis. Yes, before we go on. Yes. Willingness to pay is technically willingness and ability to pay. So my willingness to pay is going to be a very clear function of my ability to pay, strictly speaking. When people can borrow and do other, and we're looking at a household rather than an individual, it can get messy. But at the basic level, it is willingness and ability to pay. So you're absolutely right.
It also hits on risk tolerance. Wealthier people can take the risks of things, you know, like mobility issues or other types of things.
Because they can afford to compensate.
Because they can afford to compensate. So there are some background things. Not to say that, you know, some people will get in and say, but what about this person? What about that person? Many of these trends, we're talking about subtle differences that may not be identifiable in the sample, but could be part of the narrative, or if one had a perfect model, you could account for some of these things. But then any type of interaction is a second order magnitude. It's not race, age, income don't belong in the model straight up. They belong as a type of interaction variable. Therefore, you have to limit them. You cannot, as I was saying, we want every subgroup. So if you have 4 or 5 things that you want to stratify the data on, all of a sudden your sample size is 4,000 or 5,000.
Yeah, that would be nice, wouldn't it? All right, task 8 in the checklist. Back to the checklist. Statistical analysis. There is a separate ISPOR report on statistical analysis. And this is really meant to be a fairly straightforward and somewhat, I don't want to say basic because it's not basic, but what we tried to do in this particular report was to make it more accessible to more people. There's some really good textbooks out there that I struggle to work through. And then there are some primers on individual pieces that are useful but not complete. So that's why and as John mentioned, there are, and you'll see here, there are multiple methods for analyzing these types of data. We only covered some of them. They all have different properties. They're all based on different assumptions. And the key for us in putting this together was not only demonstrating how to use these things, but to help people become aware of some of the underlying assumptions that are critical mostly when it comes to interpreting your data. So when we get to, as an example, this will be a teaser, when we get to hierarchical Bayes, there was a period when every paper that I reviewed that used hierarchical Bayes, they would say, so this is the first study to get individual preferences and heterogeneity, and they never did anything with the individual preferences or the heterogeneity that they could have gotten out of a hierarchical Bayes. But that was one of the things that hierarchical Bayes came across as, yes, this is what you can do. So we were hoping people would be a little bit more circumspect and a little bit more critical. So the steps in an analysis, you get your data. And I'll show you what it looks like or how one way to set it up. You get your data from one of these surveys on the discrete choice experiment itself. So first, how do you set it up? You need to code your attributes, and there are different ways of coding the different levels that will go of the profiles that will go into your analysis. Then setting up the data for each choice question, setting it up for each respondent. We've got a table for that. Then estimation. The primary idea behind this is choice modeling. You have a choice. That's what your data says. I chose A or I chose B. Then the question is, how does that choice relate to the differences in the attribute levels between those two options? So that's what our ultimate goal is here. So conditional logit allows us to do that. And then there are extensions of conditional logit that overcome some of the shortcomings of conditional logit. And then, once we get our preference estimates, and this is key, then we do calculations on the trade-offs. The preference estimates themselves have the information in them when taken together to calculate and quantify trade-offs, but those preference estimates themselves are not trade-offs. Right, we'll show that in a couple seconds here. So here is, oh, this is the osteoarthritis example again. So we had 4 benefits. Each benefit could take on 4 levels. 2 risks. Each risk could take on 4 levels. So if we are going to code these, and I'll show an example of how to do it, we have a couple options. All of these things here are numeric. See, they all have numbers associated with them. So the levels aren't categorical, mild, moderate, severe, like John showed in the lung cancer study. They're numbers. They could be continuous. I could just plug the number in and say this is a 10, this is a 25, this is whatever. I mean, and then just have that number be in there. But if I do that, I'm making some assumptions about linearity, that my preferences for a 5-point improvement between 5 and 10 are the same as my preferences for a 5-point improvement between 20 and 25. So we tend not to start with continuous coding because that requires a fairly strong assumption that we don't need to make. So in this case, continuous coding, actual numbers. Dummy variable coding. I had 4 levels for each attribute. Each attribute in this model needs to have an omitted category for it to be identifiable. So I need 3 variables for each attribute. Level 1 is 1 if it's present, 0 if it's not. Level 2, 1 if it's present, 0 if it's not. Level 3, 1 if it's present, 0 if it's not. Level 4 is omitted, which means that all my others are 0. Basic dummy coding. Full-scale dummy variable coding. That's all this is. But I get no parameter, or I assume, if I do that, my estimated coefficient on my omitted level is 0. If we go back to this, that could work out here. If none is my omitted category, and I use dummy variable coding, I'm estimating 5 relative to 0, 15 relative to 0, and 30 relative to 0, because that's my 0. Well, none and 0 make sense, right? But what if it were just mild, moderate, severe? Which one do I omit, and how do I interpret a 0? That's where mechanically I can do it, and people do it all the time, but it causes me to have to jump through some hoops when I do my interpretation of what I get. Then effects coding. This is what I tend to use most often, not always. I don't know. I guess it's fairly standard. A lot of people use it, let me put it that way. And there are some reasons, particularly when you're doing uptake, there's been some reasons why you should use effects coding, but we're not talking about uptake today, not at least in our example. But when you've got a basic forced choice to alternative model, this and this will give you pretty much the same thing. But effects coding, you have to pick your omitted level for each category. If level 1, which is my 0 in these cases, is omitted. Level 2 gets a 1 when it's present. A 0 when level 3 or level 4 are present. Level 3 gets a 1 when it's present. A 0 when level 2 or level 4 are present. Level 4 gets a 1 when it's present, a 0 when level 2 or level 3 are present. When level 0 is, or my level 1, which is 0, is present, everything else is a -1. I'll show you how that works. And I hope you'll kind of see how that goes. So in continuous coding, these are my levels. I just take the numeric level, and that's what gets plugged into my model. So it would look something like this. For the first question, the ID is the same. It's the same person answering the same question. The choice is, did I choose A or B? A's on the top, B's on the bottom. My level in A for ambulatory pain was 25. My level for ambulatory pain for item B was 50. I can create that choice question just by looking at these data as well as what they chose. So this is one question for a two alternative thing. They're just stacked. Right? There are other ways to do this, but this, to me, is the most intuitive way to describe it. All right, so this is the data for the first choice question. So with dummy coding, remember I said I've got my omitted level of 0. That's always 0. When 25 is present, that's a 1. When ambulatory pain of 50 is present, that level's a 0. When ambulatory pain of 75 is present, that one's a 0. That's full-scale dummy variable coding. I'm assuming everybody is at least familiar with that. Everything is estimated relative to the omitted category. So my preference weight that I get on that level 25 of ambulatory pain is a beta. Assuming beta 0 is 0, it measures for me the deviation between this and that. Same thing for here, between this and that. Between this and that. So my 0 anchors me somehow. It has some meaning there. When I do effects coding, when that level 75 shows up, it's a 1. When 50 or 25 show up, it's a 0. When my omitted category shows up, it's a -1. See, these are all -1s down here? The first thing that makes this useful is I get a parameter on my first non-omitted level, get a parameter on my second non-omitted level, get a parameter on my third non-omitted level, and I can recover the parameter on my omitted level. It is the negative sum of these 3. My 0, however, has a totally different meaning now. My 0 is the mean of these 4 things. It's the mean effect of the attribute. You'll see why we don't care when we get a little bit further where the 0 is, as long as it's not fixed at having a parameter on 0. So the data layout for dummy coding, same question. Question 1 for person 1, they choose item A. I can say, all right, ambulatory pain in option A was 1, or ambulatory pain in option A was 25. Ambulatory pain in option 2 was 50. Ambulatory pain 25, 50. They look exactly the same. Where it gets weird is when my omitted category is present in option B here for resting pain. It's 0, 0, 0 when it's dummy coded. It's -1, -1, -1 when it's effects coded. But the data layout is the same. All right? So then this is what a full-scale effects coded data table would look like. I have person 1 there on the left. Question 1, question 2, question 3. I can tell it's a 2 alternative design because I have 2 rows per question. So I know there must only be 2 alternatives or I've coded my data incorrectly. In question 1, person 1 chose A. In question 2, person 1 chose B. In question 3, person 1 chose B. In question 2, A had no ambulatory pain. 0 is my omitted category. It's all -1s, et cetera, et cetera, et cetera. Same thing for number 2, person number 2, person number 3 for every question. You'll see when we do the analysis that the choice is analyzed as a function of the attributes and the attribute levels in the choice task. My choice between A and B in question 1 and my choice between A and B in question 2, my age is the same throughout. My age has no effect on how I make that choice, or at least how I make that choice from question to question. I don't get a year older as I go from question 1 to question 2. So these drop out. So we are relating choice to the characteristics of the alternatives, not to the characteristics of the respondent. we can bring these back in. But this is why, one of the reasons why, getting down to individual level estimates and doing subgroup analysis can be a big challenge in discrete choice experiments. And why I put so much emphasis on some of these other methods that give you a single number that you can just regress on those characteristics, give you something very different. So, if we think about this in terms of random utility theory, we can think of this as a utility function. The reason we like random utility, especially for someone like me who started out in environmental economics, was essentially Daniel McFadden showed that the conditional logit model, which really is a multinomial logit model that relates choice to attributes of the alternatives rather than choice to the characteristics of the chooser, is consistent with economic theory. All right, so that's where this comes from. We can have a debate on whether we have to stick strictly to choice theory when we do this, but this is the framework that we use. So we have the value, or the utility function. Attribute levels. We get a parameter on all non-omitted attribute levels and recover the parameter on the omitted attribute levels if we've used effects coding. The key is we have this random error term. And that's where all the action really is. And that random error term is what we assume if it's type 1 extreme value distributed, we get the logit function. So main effects and interaction effects. We talked about this a little bit earlier. So main effects simply are, I get a single parameter on each attribute level included in my study. It tells me the independent effect or level of preference for that attribute level, regardless of or independent of the level of any other attribute. So when I design this study, I want everything to be independent from a preference perspective. What I don't want to have in order for this to work is someone say, well, I would choose this because that one's there, and if that one's there and that one's there, I'm okay. But if that one's there and that one is somewhere else, how I view the first one is different. Frequency and duration of infusions. This is one of my, I can't believe I was so dumb moments. We're developing a survey. We've got frequency and duration of infusions as separate attributes. We go into pre-testing, and I kept hearing, well, I could do it more often if it were shorter. My preferences for frequency were dependent directly on the level of duration. That means I have to have an interaction effect. I have to interact frequency and duration. In a perfect world, I avoid that completely and just get my main effects. And when we show some examples of analysis, it's just going to be main effects. So interaction effects can be interacting different attributes, where my preference for the level of one attribute are dependent on the preferences for or the level of another attribute. The other types of interaction effects that I can have are I can bring in income, for example. If I'm doing willingness to pay, that's my goal. I have an out-of-pocket cost attribute. I may want to interact that with the log of income, with the natural log of income, because I expect that the marginal disutility of an additional dollar of cost is going to be a function of my income. But I have to interact that variable with one of my attributes in order to bring that back in. Main effects. Random utility, I don't think, okay. Conditional logit. The probability of choosing option I, or let's call it option B in the case of our thing, is the exponent of the value function associated with that alternative over the exponent of the value function of all the alternatives available in the choice set. So in this case, for question 1, it would be, I'd have a probability of choosing A would be the exponent of the value function A, which is a function of the levels of the profile in A, over the sum of the exponents of the value functions of A and B. So this is my choice set in the bottom. The probability that I choose one of my choice set is related to that. All right. In this case, 2 alternatives, so J equals 2. So important to note that when we have a 2 alternative choice in any comparison, pairwise comparison, the probability of choosing one is 1 minus the probability of choosing another. And it also has some properties of whether you have extremes, whether you're at the extremes or closer to the middle is going to affect how sensitive that probability is to certain chains. It's the logarithmic distribution. Generally, that's not what you need to worry about, but in certain circumstances it can happen. But essentially, again, this is a logistic regression and important to note. So here's an example where we're going to show what the results look like and interpret a little bit of the results. This is the example that is in the Statistical Analysis Task Force report. We have 3 attributes, generic attributes. Efficacy, level 1, level 2, level 3. Level 1 is the best, level 3 is the worst. A side effect, level 1, level 2, level 3. Level 1 is the best, level 3 is the worst. And a third, mode of administration. Notice this is numeric. More is better, so they're naturally ordered, the way that we've set it up here. These are non-numeric. These are categorical, mild, moderate, severe. I don't have a number associated with those levels, but they're naturally ordered. Mild should not be preferred to moderate. Moderate should not be preferred to severe, all else equal. Mode of administration, however, is categorical. May look naturally ordered, but if we assume it's naturally ordered, we are imposing our priors on what patients think. It may or may not be naturally ordered. In this case, I don't think we set up the data this way, but the best example I have that really, really kind of changed my thinking about this was when we were doing a study in oncology when a lot of oral agents were becoming available, and there were people who preferred infusions to oral agents, all else equal. And the reason was going to the infusion center was their social outlet. So if I got my results back and didn't know that and saw that infusions were referred to orals, I would have thought I made a mistake. In fact, I just didn't understand well enough where the patients were coming from. So my results weren't necessarily wrong, but I would have interpreted them improperly. So what I get from conditional logit in an effects-coded world is a set of coefficients. All right? The actual size of each coefficient cannot be interpreted in and of itself. It's all relative to everything else. But here's how we begin to think about it. 0.26 greater than 0.02. Level 1 is preferred to level 2. Level 3 is just the negative sum of those two by construction, and should be, as long as it's less. All right. If this were 0.26, this were negative 0.26, this would be 0 and show up in the middle. So that artifact of having this be the negative sum of the others does not force ordering. That's a concern that I've heard. It will reflect the ordering. So these are ordered properly. Level 1 preferred to level 2, preferred to level 3. Order is proper. Negative doesn't matter here. The negative is what I've essentially imposed here because it's got to be centered around 0. So the sum of these 3 has to be 0. But that's an artifact of my coding. Negative doesn't mean this is bad and these are good. It means that this is bigger than that by a certain amount. This is bigger than that by a certain amount. Look here. First, let's go back. Oral, sub-Q, IV. Sub-Q preferred to oral, preferred to IV. These are made-up data. I did that specifically so that I could get that reaction. And I could tell my story about the infusion center, all right, which I told first before I showed you this. So the point is, these are naturally ordered and numeric. These are naturally ordered and non-numeric. But naturally ordered, I would expect to see at least if they're disordered, they're not statistically significantly different. But here these are ordered. This one is not naturally ordered. I can't impose my own beliefs on what the order should be. I may have a prior on it, but I could also be proved wrong, as in this case I forced us to be. So that is for effects coding. This is for dummy coding.
Can I just ask you, so the
Please.
for the effects coding are whether that's significantly different from the average?
From the average. That's another issue. That's correct. That is, and this one here is whether it's different than 0, which has its own thing. You know, yeah, so that's another issue. And the sizes of the sizes of the standard errors are going to be bigger because they're estimated relative to different things. This, my distance from 0 is going to be bigger here than it will be here. Okay. So yeah, you wind up with getting those things, but the standard errors themselves are often unhelpful in and of themselves because it's different than whatever 0 happens to be. Okay. We can use those data and the covariances to figure out whether they're different from one another, but that standard error that pops out of the regression does not tell you that. Okay. Dummy variable coding, same ordering throughout. The differences are the same. There's a 24-unit difference here, a 24-unit difference here. Due to rounding, a 30-unit difference there, a 31-unit difference there. So this is constrained just to be 0. So if I do effects coding and plot them out, I get that. If I do dummy coding and plot them out, I do that. But my difference between this one and this one, and between this one and this one, is the same as my difference between this one and this one, this one, and that one. In effect, what I am doing is just shifting all of these up when I do dummy coding by whatever the amount of this negative is. I'm just taking everything and shifting it up and raising up the numbers. That's in effect, there are other differences, but functionally for a main effects model, that's the difference. The nice thing is when you go there, I had alluded to the fact that, you know, what does 0 mean? And sometimes when 0 is IV sub-Q pill, which one's 0? You know, it's arbitrary. So then we have to make sure that we're saying relative to every time we do it. When we do effects coding, I get a parameter on each one of those. So that's kind of a nice benefit of this, and really one of the most practical benefits. There are some people who will swear by effects coding because your preferences are confounded perfectly with the grand mean. I have yet to see in a main effects model where that actually makes a difference. So there are some statistical reasons why this may be preferred. But I have yet to see the practical implications of that play out in the type of work that we do. All right. So the conditional logit, we're going to skip this one. We had a different handout for that. So the conditional, we get those preference weights that we got were the average preference weights across the sample. They do not account for heterogeneity. They do not account for correlation among my own responses in a series of questions. They treat every observation as an independent observation. However, it has a unique solution. You can do it analytically. You don't need software actually to do it. And it's commonly available. You have to be a little bit careful in the command for C-logit versus conditional logit in some cases, but it is commonly available. This one I'm not so sure about as we go back and look at this about sample size. Relative to the other estimators, it does in the extent that we're estimating fewer things, but I don't know how real that is in practice. So I wouldn't put too much stock in that, but assumes homogeneity in preferences, does not account for the panel nature, and is not guaranteed to converge. That I'm beginning to find that is a result of software. Then you'll get differences in convergence with software, and I haven't figured out what's going on with that yet. But This rarely happens that you have convergence problems with this. All right, one of the problems that we showed was heterogeneity. It's come up a couple times already today. You and I can look identical on paper. Everything you know about me and everything John knows about you and everything John knows about me could be identical. And our responses could still be very different. Right? There are just things that are totally unobservable that influence our preferences. So even if you knew me perfectly. So we need to account for that somehow. That's what these other methods that we're going to talk about actually do. There's also scale heterogeneity that John began to talk about a little bit before. Scale heterogeneity in the extreme means that, at least in theory, every question that I answer, I am somehow different and the circumstances are different when I answer question 2 than when I answered question 1. Therefore, the variance in my responses is going to vary question by question. That's the extreme end of this. In reality, what we want to say, or what we want to test for, is that for reasons like making errors and paying attention and doing things like that that are not directly related to my preference, can influence me differently than they influence you. So the variance and bias in my results may be different than the variance or bias in yours. So we want to test for that and control for that. Normally, we don't do that on a person-by-person basis. We do that more often on group-by-group basis, because people who come from a panel, let's say, somehow just might be systematically different than people who came that were intercepted at a conference, let's say. So when I use different modes, when I do different countries, you could go to the extreme and say every question is different and there's scale heterogeneity by question, and there are people who do that. As a pragmatic matter, at least in my shop, we tend to say where do we think it would be present that we want to test and control for it. And I do have an example, if we have time today, of where we did find that from doing mixed modes in terms of recruiting. All right, marginal rates of substitution. We got our preference estimates. Now, how do we actually turn those into trade-offs? So imagine that I have some indirect utility or value function here where I have everything here. If x are attributes, this is not a vector, and I have one parameter on each one, I am assuming that these are linear, and that my preferences for changes in those attributes are linear and continuous. Right? If that is the case, I can say that my marginal rate of substitution from one to the other, what I'm willing to give up in one to get the other, is just the ratio of the parameters. Negative ratio of the parameters, which John did. That's the absolute. Did I do? I did. All right, I did need my negative in there. Remember John put the negative when he did willingness to, or time to do the ratios? Because you have to give, how much of a decrease in one or a worsening in one are you willing to get something better in the other? That's why it's negative. Because you could have two good things. I'm willing to give up so much broccoli in order to have more candy. All right, so they both have positive coefficients if they're goods. So it would be, I'd have to say what I'm willing to give up is that a negative change in this is offset by a positive change in that. All right, here's an example where we're going to do some calculations. Imagine we have a question on medical tourism, all right, for some sort of surgery. Different levels of wait time, 2 levels for location. Here, ex-US. Different out-of-pocket cost. All right. When we put an attribute table like this together, we assume that everything else is held constant across all of the alternatives that you will see. Quality is the same. Right? I need to assume that, or I need to put that in as an attribute. And if I assume that, I need to tell you that. In the survey, I need to say, when you answer these questions, assume that the quality is the same in both. Otherwise, quality is going to sneak in there, and I'm going to have no control over it. Right? So quality is the same. This is what the question might look like. If you had the option of choosing the location in which you had your operation, which would you choose? And kind of the, well, this is not a, the wait time would be shorter, the cost would be higher if you went to Mexico. Right? But I would do this according to an experimental design. I'd get the individual trade-offs. I'd come up with numbers like this. Every additional month decreases my utility by 0.59 units. If I'm in the US versus Mexico, my utility goes up by 0.77 units. So location, yes. US is 1, it's a dummy variable, 0 to 1, I get a 0.77 bump. Out-of-pocket cost. Every $1,000 in out-of-pocket cost decreases my utility, my value function by 0.2. These are unit-less. They only make sense when you look at them together. So shorter wait times are preferred to longer wait times. Locals preferred to foreign. Lower cost is preferred to higher cost. This has face validity. I made up the data. Of course it does. So how long are US patients willing to wait to have surgery in a local hospital instead of going to Mexico? How many months? All else equal. How big is this compared to that? How many changes in this one do I need to have to exactly offset that one? It's about 1.3 months. 1.3 months wait time decreases my utility by 1.3 times 0.59 decreases my utility, so by 0.77. Moving from Mexico to the US increases my utility by 0.77. So what I've done here is I've said, you can stay at home. I've increased your good thing. I've moved from left to right on that graph that I had. Then I'm saying, now I'm going to start making you wait. How much can I increase wait time until it exactly offsets it? Well, if each month of wait time is 0.59, 1.3 months basically makes me equally well off to where I started before I told you you could come to the US. Try another one. How much would I be willing to pay to decrease wait time by 1 month? Let me make sure I did this right. There was a... Yep. Every $1,000, if I can increase wait time by 1 month, I increase utility, I decrease this negative by 0.59. Right, so 1 month decrease increases my utility by 0.6. Every $1,000 in costs, additional costs, decreases my utility by 0.2. So if I make this better by 0.6, how many thousands do I need to exactly offset that? 3. So to have decreased wait time by 1 month, I'd be willing to pay about $3,000. Yes?
So my initial thought with your first question and with this one is that you would have to do a threshold study to actually state that that's what it is. Can you make that assumption that these are linear processes? And, well, it's in your model that they're linear processes, but that you can take that jump of for 1 month, what do I need to do? Or do you actually, I mean, would that match if you did some sort of threshold analysis where you held one thing constant and varied the other to find out at what point
There are 2 questions embedded in there. So the first one is, without doing a threshold analysis, I could estimate a categorical model and see whether my change from 1 month to 2 months, my utility change from 1 month to 2 months, was the same as my utility change from waiting 2 months to waiting 3 months. So that's the nice thing about estimating things categorically is I can see whether it looks like it's linear or not. All right, so let's assume that I did. I would be misspecifying this or making a very strong assumption had I not done that. Now, whether I can do a threshold technique and come up with the same answers is a great question, and I would love to do it. Generally speaking, none of us ever do that. Budget and time. Budget and time. Oh, so I would get, if I did this, I would do a model. This would be my sample level model. I'd do my threshold not with one individual, but with everybody in the same sample. And to see if my mean is the same. Yeah, yep, yeah.
Do you ever want to combine and say, I want to come up with a function that combines wait time and out-of-pocket costs?
Yes. Yeah, these are, this utility function, this is linear and these are additively separable. So I can say if I bump this one up by a month and this one down by 2 months, am I more likely to go to Mexico or stay in the U.S. or stay in the U.S.? You know, if I want to stay in the U.S. and decrease wait time, and people and have wait time increase by only 1 month, how much cost can I then impose under that scenario? Yes, so my whole point is any change here, all my deltas need to add up to 0. Because if I make something better, I need to make something worse. That's where I get my actual rate of trade-off. Okay? So I'm doing them pairwise, but you could do them elsewhere. It would actually be cool to do this with a threshold scenario. I would love to do it. I'm trying to get that to happen. But a lot of it is who the funder is and what their objectives are, and sometimes funders are just not interested in cool methodological stuff. So, but I think we could do that. So extensions to conditional logit. The biggest problems with conditional logit are you don't account for the panel data and you don't account for heterogeneity. So the 3 things that we're going to talk about now briefly are random parameters or mixed logit, hierarchical base, latent class. All right. They mostly address, in some form or another, this issue of heterogeneity. So random parameters logit. We're not just, when we do random parameters logit, we are not just estimating a mean coefficient on an attribute level. We allow for that to have a distribution across the sample. And the distribution is not across me. I have my own preference weight for that that we will estimate that has a standard error around the estimate. This is across the sample. When we all together do this, there's going to be a distribution on each preference weight. All right, we can assume it's normal, log normal, they're triangular, but we assume some distribution. And then essentially, we use simulation techniques to get this. So it's the same, essentially the same logit model, except now our betas are not just the means. Our betas are means and distributions. That's basically how it goes. So from the data, looking at some of the dispersion in responses based on how I respond systematically and you respond systematically over the series of questions, I can use methods for estimating what that distribution is. I have to specify the distribution a priori. Empirically, it's difficult for me to go back and test the distribution. So in essence, what I am effectively doing is controlling for heterogeneity. I always want to stop short of saying I'm modeling heterogeneity, because really what I'm doing is controlling for it. I don't feel like we have enough to model heterogeneity. We know it exists. We need to be able to do something with it. All we can do is say, is there heterogeneity and how much? But I hesitate to say that we're modeling it because I'm not really explaining it. I'm in essence first purging my means of the effect of heterogeneity, which could theoretically bias my mean estimates. And I'm imposing a distribution. And I'm not saying who is where necessarily. Right? So what I get when I do this, effects-coded random parameters logit, I get a coefficient estimate, a mean coefficient estimate on every attribute level. The numbers are almost identical to what I got in the conditional logit, but I created the data set, so it's going to happen that way. So this looks like exactly like, or very much like, I should say, the conditional logit. And it should. But I also get standard deviations. So I get a beta and a standard deviation about the beta. Now, what is interesting on whether the standard deviation about the beta is statistically significant tells me that that standard error does have meaning, and that p-value does have meaning, because it tells me whether the dispersion is wide or narrow. Is there a lot of heterogeneity in this parameter or little heterogeneity in this parameter? All right? In terms of, if I were to model the same parameter across the entire sample, do I have people on this end and this end, or is everybody pretty much close to the middle? Right? So random parameters logit accounts for heterogeneity. Implicitly, it accounts for the panel nature of the data. It is not available in Sawtooth. It's increasingly available in other software packages. It is not in Sawtooth. It can be more difficult. You're going to do one. You'll see that it's a little bit longer. It's a lot less difficult than it was. When I was in grad school, we couldn't estimate this. It would take a week, and the computer would shut down before it would even estimate it. But I was also working on a Pentium at the time, if it shows you how old I am. So, you know, there was a time when it was technically not feasible to do it. But it is a simulation method. There are, you know, it can be sensitive to the draws that you take, like any simulation method. It is difficult to replicate the exact numbers in multiple software packages. The means look pretty much the same, but the standard error or the standard deviation's not necessarily. We've at least had that problem, John. I don't know if you've had that or not. I mean, so it's a simulation method. You're not always going to get the same thing. And you're estimating additional parameters. And while you may get a better fit to your data, you need more data because you're estimating additional parameters. And requires assumption about the distribution. And there are pros and cons of different distributions. There is no strong theoretical basis for using one over the other. Log normal, I think, is becoming sort of the standard accepted instead of normal, because you have some parameters that just crossing 0 makes no sense. So you want to bound it at 0 in some way or the other. But a normal distribution is no worse than any other, necessarily. The triangular distribution was popular earlier on because it was easier to estimate with a triangular distribution than a normal distribution. I think most of what's out there is either normal or log normal right now. But again, the researcher is imposing that based on limited, if any, information. Was there a question here? Okay. All right. What time is it? We may skip this example, come back to it if we can. All right, hierarchical base. I am not, what's it? Just manipulating the coefficients in the conditional logit thing. You've got that in yours? Perfect. All right. Hierarchical base. Kind of estimates individual level preferences. You get a set of preference weights, a set of parameter estimates for each individual. Getting those requires some assumptions about the deviation of each individual from the mean of the sample. It is essentially a Bayesian technique. To be able to break everything down to the individual level that way, first of all, you are approximating an individual level. Also, everybody, if you want me as an individual to have a parameter estimate on everything, I need to see a lot more of the design than if I'm just one among many. All right, so it has issues for design and John alluded to that earlier. The other challenge that I have with hierarchical Bayes, and it's used a lot, and actually I think it's very powerful. I've seen it used a lot with smaller sample sizes, which I think helps a lot when you are stuck with small sample sizes. There's a lot of potential power in this. The challenge for me comes along with the fact that I get for any individual a parameter estimate, essentially the same ones that I got there for any individual. The mean parameter estimates are the distribution of all the means in the sample. Right? If I get an individual one, I want to know what the mean is in the sample. I get that. I get this nice little distribution. I don't get a standard error on the mean parameter estimate. I get a distribution on the mean over the sample, but I don't have a sample-wide mean estimate with its own standard error. And if I want to do inference testing on the mean of the sample, that's a missing piece for me. It's a nuanced limitation, but it's something that I've run into a couple times lately that has caused me some concern. But it is a powerful tool. You will see it a lot in the literature, partly because Sawtooth uses it. So this is in Sawtooth. This is one of Sawtooth's big things. And because it works well with smaller samples. I don't understand it quite well enough to know what's going on other than in sort of the Bayesian conceptual framework that I am supplementing my data with some priors and some updates. So here, though, if I look on my data set that I used on these made-up data that we've been talking about sort of throughout, I am basically finding here my means are about the same for a simple, straightforward main effects design. The methods all give me generally the same thing when it comes to looking at the mean weights or the mean betas or the mean parameters on each of my main effects. Where there are differences is that the size of the standard deviation appears to be different here. This is building up from individuals to get the standard deviation in the sample. This is taking a distribution about the mean and simulating that almost backwards. All right, so they're different processes. Here, in the mean estimates, they seem to be very similar. On the standard deviations, they tend to be somewhat different. Latent class. So latent class is pretty cool because you let the data tell you how respondents sort themselves out. There are, the first challenge is, how many classes do you have? There's some guidance on how to do that, and you can look at some of some test statistics that can guide you through that process. So there is a way to think about how many classes the data are telling you exist. Depending on your research question, you may say, practically speaking, only 2 or 3 are going to be relevant. I mentioned to some of you earlier some of the work that Chuck Cunningham does in policy, and he uses latent class a lot. Essentially, the premise is they want to develop a program, an intervention of some sort that should be responsive to preferences, but not everybody may have the same preferences. So how many programs do we need? If he came up with 36 different programs, no one would do them. I mean, no one would implement the programs. So in a lot of those cases, it's do we have 2 or 3 different classes, segments, where we can say this message is probably going to resonate more with this group, or this group. Then you can look at the probability of being in each one of those classes and model that as a function of the individual characteristics. Sometimes it works, sometimes it doesn't. Sometimes it doesn't matter. Sometimes it is, we need 2 policies instead of 1, but I can't necessarily target them, but I need 2. That's informative, that's useful. The people are telling you through the latent class analysis of their own data, hey, we got 2 different groups here, or 3 for that matter. But if you're using it for to try and get at subgroup analysis, what you do is you're saying, the data are saying, I've got 3 different classes of preferences. They're systematically different, and you can plot them out and see how they're different in different ways. So these people might be really focused on this, these people might be really focused on this, and the third group might be focused on something in the middle. So those distances in the bar charts that I showed before would be greater or smaller in different groups. And you could plot them next to each other and do some really cool stuff. But if you want to say who's more likely to be in group A or group B or group C, you can look at, you don't get an individual is in group A. You get a probability of being in group A. So the higher the probability, the more likely you are in that group. A, what's the cutoff that you use? And there are some conventions for doing that. And then relating which group you're most likely to be in to what I know about you can be useful. I don't think it's as precise as we would like it to be. Because we're talking almost like a third, just intuitively, think about it. I've got these preferences from a group of people. They're segmenting themselves out. This respondent is probably in this group. What makes this person more probably in that group who is more likely to have those preferences? There comes a time where unless the differences are big, unless older people really, really are on this side and younger people are really, really on that side, it might be hard to detect real differences. So when we start looking at subgroups, another key thing in any preference analysis, because there is heterogeneity going on, because when we start doing these multi-attribute functions, we have to remember that when we do subgroup analysis or we want to explain how my preferences may differ from your preferences based on some observed characteristic, we may only be able to detect it if it's big. So just because I don't detect a difference in preferences between two groups doesn't mean that it doesn't exist necessarily. It just may mean it's not big enough to show up given the sample that I have and the complexity of my model. So subgroups are a big challenge here. So we want to control for heterogeneity, but controlling for heterogeneity does not mean that we get necessarily good information on subgroups. So we have a checklist. Every task force report is encouraged to have a checklist. And this is the estimate checklist that we have. Again, the report is downloadable from ISPOR, so I will not necessarily go through everything. But again, just like the other checklist, it is a set of questions to consider. All right, did you think this stuff through? There are options in survey design that we talked about this morning. There are options in analysis and how you specify your model. So did you think through all of your options, and why did you choose one over the other? And if you did a hierarchical base, do not tell us that you were the first ones ever to do preference heterogeneity, model of preference heterogeneity. Sorry, that one really got under my skin, yeah. Oh, to the task force report? Under the task force reports link, really? All right, we'll get that fixed. We'll get that fixed and send that out to the group. I thought it was there. I thought I pulled it down. Maybe I haven't. Okay, we'll either send a copy or we'll get it fixed and let everybody know. Thank you for pointing that out. I had no idea.
If you do it on Google Scholar, it might have it as a link.
Or yeah, if you go to Value in Health, it's free download. It's not restricted, so that may be in Google Scholar or PubMed. You should be able to get it. But we'll still get it fixed because it should be linked in there. So again, these are, all the tasks for so far are set up as questions, as issues to consider, things to think about, things that you should not just ignore. Or if you think it's not relevant, you think about why it's not relevant and then check it off. That's kind of the idea behind these checklists. And then interpretation and assumptions. And I think we're early. Are we? 3:30. Oh, I'm looking at time elapsed. Sorry, I was looking at the wrong counter. Let's go through the hands-on example, and then if we have other questions about analysis at the end, and maybe we can talk about it also in some of the case studies, we can come back to it. So John, you want to
This is slated
grab
for
it?
half an hour. We can either have a 5-minute break now or a 5-minute break at the end of this. What would people prefer? At the end.
All right.